Hi, my name is Sophia Aguilar, and for my medical research project, I'll be doing osteosarcoma for my fourth project for sports medicine. Osteosarcoma is a bone cancer, and cancer is when cells in the body grow out of control due to DNA alternations, usually leading up to the cells clumping up together, also known as a tumor, which is dangerous because it can affect healthy tissues around the tumor. And osteosarcoma is a common type of bone cancer that mostly affects children, teens, and young adults. Some symptoms include swelling near a bone or joint pain, bone injury or bone break for no reason at all, limping, and of course, a lump. Where does it start? Osteosarcoma grows quickly near the ends of the legs or arm bones, develops around the knee, lower part of the thigh bone, or upper shin bone. It can also grow in the jaw, pelvis/hip, and shoulder, but shoulder is mostly common in adults than they are in children. There are three classifications of osteosarcoma: high grade, which is the fastest growing and occurs mostly in teens and children; intermediate grade, which is uncommon but falls between low and high, usually treated as low; and low grade, which is the slowest growing and it looks like a normal bone and usually is only treated with surgery and it does not need chemotherapy or radiation therapy. There are three types of main treatments. There are surgery, chemotherapy/other drugs that come with it, and radiation therapy. Radiation therapy is high energy rays targeting the tumor and cancerous tissues around it. And radiation therapy is recommended before surgery so it can shrink the tumor so it can be easier for surgeons to get it out and also cut out the cancer infected tissues. And above course you can do it after the surgery too. And radiation therapy does not kill cancer cells, but it can remove remaining cancer cells, and it can also help slow tumor growth and control symptoms like pain and swelling. But of course there are some side effects that come with radiation therapy, like effects on the skin, getting sunburn because of the radiation the skin is receiving. Hair loss, radiation to abdominal or pelvis can cause nausea, diarrhea, and urinary problems, and affect bone growth, especially in children, which the limb can be longer than the other or shorter. Chemotherapy and other drugs. Chemotherapy is a 10-week cycle program, which usually there's a rest cycle period, and again, chemotherapy is recommended before surgery so the tumor can shrink and it'd be easier to take out. And the venous access device, which is inserted through your vein, and fluid is inserted so it can attack the cancer cells and remove some cancer cells out, hoping it doesn't come back. And of course, chemotherapies are very harsh, intense treatment, so there's going to be some drugs given, but of course, these drugs can cause side effects and it can affect give liver disease and affect the brain. And there's other side effects that come with chemotherapy, which is damaged bone marrow, nausea and vomiting, loss of appetite, diarrhea, hair loss, mouth sores, low white blood cells, which low white blood cells help fight against infection, and without it, and if you have minimum, it can increase your risk of getting infections. There are two types of surgeries: amputation and limb saving surgery. Amputation is removing the cancer and part of the limb, but not all of the limb. So during amputation, the surgeon is just gonna um, shorten and smoothen the bone in the remaining section of the limb so it can be covered with a soft tissue and muscle. Then the surgeon is gonna stitch up the muscle to the bones to help straighten the remaining section, which a technique is called mitosis. And of course, after the amputation, the wound will be sealed with stitches or surgical staples, and it will be covered with a bandage and a tube to remove or drain excessive fluids. And a bandage will be placed to reduce the risk of infections. As you can see here, you're going to close it up, and that staples to the limb to close it up. And limb saving surgery is removing the tumor in limb without actually removing the limb, and doctors prefer to approach this way if possible, but sometimes there are complications with limb saving surgery that could eventually lead up to amputation. So amputation might be the best option. But limb saving surgery is when the bone and tissue around the tumor can be removed and an implant, like an external um, prosthetic, can be placed, or a donor or another part of the tissue or bone in your body can be placed there instead. After the surgery for amputation, you'll recover in a ward. You'll be given oxygen through a mask and fluids through a drip. Urinary cardiner is placed so you don't have to actually get out of bed to use the restroom. Painkillers will be given because you'll be in a lot of pain. You'll be given exercise to prevent blood clots in your stump, and you won't actually receive a prosthetic limb until a few months after your surgery if you meet the qualifications to it. But for rehab, you'll be given to learn how to live your daily life without your other limb. But usually, you'll be given a wheelchair, uh, a cane to help move around for the first couple of months during rehab. And if you do get approved for a prosthetic limb, you'll also be learning how to use it and how to function with it. For the limb saving surgery, you'll spend 5 to 10 days in the hospital. Drainage tube would be placed for 24 to 48 hours, extensive rehab, and then most patients will start continuous passive motions, muscle strengthening, and range of motion for at least a day after the surgery. It's a 12-month rehab program, and within a year, well, it would take up to a year to learn how to walk in. You'll be given a brace, a walker, and a cane. But also during amputation, I forgot to mention this, for rehab, you will learn how to take care of your stump, and also to mention some patients will feel phantom limb, which usually is sensations of the limb that was there are sent to the nerves, and you will feel these painful, like almost like cramps happening because of the nerves in the stump sending back to the brain of actually feeling pain in that limb if as if it was there. For prosthetics, we have body power, which the body can control the prosthetic, and here you're gonna see here, and then you're gonna hear this guy explain how it works, and then
Here's how a body powered upper limb prosthetic works. There's a strap tight across my chest. It's attached to a cable, just like a bike brake cable. When I move forward, it bends the elbow, or if I spread my shoulders out, same thing. If I stop and lock the elbow, those same motions will open the hook, which closes on the force of some rubber bands. It's confining and clunky.
here you can see he's just using his body to like function the prosthetic. For motor power prosthetic, as you can see here in this picture, there are buttons and switches which control the prosthetic to move almost like a robot, but there's some cons to having this, which is the limitation of how far a person can walk and how long their battery can last without dying. But the most best prosthetic is the myoelectric powered, which is electric signals impulses from muscles from the existing body, sends signals to function the prosthetic, as you're going to see right here with this guy right here, as he is moving his limb almost as if the limb has never left his body. Again, it's just the electric signals controlling it. Of course, with the journey of the with osteosarcoma, it's going to have an effect on the body and the person. Pain is going to be felt all over the body. Serious symptoms will happen is nausea. Body changes like hair loss and weight loss will happen. The person will feel weak and a different outlook with life, especially with a person who has a new prosthetic. They're going to have to change their ways of their old life habits and creating new habits of how to function in their everyday life. Infertility can happen in young children due to the radiation and chemotherapy. And of course, the person is going to feel exhausted and tired and want to just forget about their cancer journey. But it is important they don't forget about it because cancer can come back. So it's important for a person with cancer to be in a cancer group and be with other cancer patients so they can help each other and motivate each other through this journey and help each other and share experiences with each other. Thank you for watching of my medical research project on osteosarcoma.